This is evidence-based decision making, and basically evidence-based decision making is a process that you will use to look up information to provide the best care for your patients. It's a strategy for proving efficiency when integrating evidence to your practice. So this is a standard practice within dentistry, within dental hygiene, and with the medical community where you're looking up research to support your clinical decisions. So we're always using research to help us make good decisions for our patients because it's always changing. So what was appropriate 40 years ago and what we were using for best evidence years ago was very different from it is today. So now you're in school and you'll be getting the current evidence, but when you get into private practice, it's going to be important that you stay up with the literature, know how to read the research yourself, so that you'll continue to always provide updated, the most updated standard of care for your that's best for your patients. So evidence-based decision making, it's using research, it's using your judgment and your experience, it's applying it to the particular clinical patient circumstances, and of course you have to take in consideration your patient's preference. You may want to use the new airflow with glycine powder, and you know that it's more effective on implants and the literature has showed that, but your patient may absolutely hate it. So therefore you won't be able to use that, but you also need to use your patient's information to help guide you. So then you might have to look at the second most efficient or effective treatment for your patient. So the fundamentals of evidence-based decision making, they're based on your clinical decisions, and you have to consider the level of evidence. So all research is not the same. There are some research studies that have more impact than others. So hopefully we start to think about looking at what we're reading and interpreting it and helping us guide us make clinical decisions. So here's a hierarchy of research and kind of stacking it and showing you what kind of research might be more powerful. So you can see the bottom is animal and laboratory studies. So if it's done on a study might be fabulous and show great results, but if it's done on an animal, you really can't translate that to a human. Sometimes it does, but it's really unknown. Case reports. That's basically when you're looking at single patients examples, and it might get new literature started, but it's not that powerful. Case control studies, these are retrospective studies that look back in time. For example, there's a study like a Framingham heart or something, which is technically a cohort, but then you realize you're looking back at what happened to those patients, so you're not following people forward. And then the cohort is the prospective, and the cohort in these case control studies, there's no control with the clinical investigator running the experiment. It's an observational study only, and that's contrasts with the randomized control trial, which is experimental, and that means the investigator has control over the study, meaning there'll often be a placebo, and one group will get, let's say, the chlorhexidine rinses, and one patient will get a new experimental rinse, as opposed to a cohort study. It was people chose to do the rinse they wanted to do, and you just looked back. So certainly assigning different a product will have a different impact. You know, why did that person choose chlorhexidine over the new rinse? Is it they were familiar with the properties or knew it was better to begin with, or something like that? So randomized control trial is one of the highest levels of evidence. And then the next two are meta-analysis, system reviews, and then clinical practice guidelines. So that's the highest level of evidence. So if you're trying to find it's always a good bang for your buck when you're getting one of these higher levels, because it means more, it's more powerful. Example, if I could find 30 animal studies to say this new product was effective, I'd rather find one clinical control trial on a human, or a meta-analysis or clinical practice guideline would give me a lot more evidence. So basically what this triangle is saying, it's not just about reading articles, it's about the kind of research that was conducted, it's about how it was done, will help us guide us in our clinical decision making. Excuse me. So basically we have primary research, which is experimental research, randomized clinical control trials. This is the strongest evidence. So we call that primary research, primary sources. So that's an investigator does a study and reports it directly in a journal. That's primary. Non-experimental or observational research. This is the researcher does not give a treatment intervention or provide an exposure. It's data that's gathered without intervening to control the variables. So that's the difference between the experimental and the observational, the cohort or case control studies. So secondary research includes research that's already conducted by individual studies. So at the top of that pyramid, you saw the meta-analysis, the systematic reviews, the clinical practice guidelines, and those are all secondary research. And that means an investigator reviewed the literature, other studies on that topic, and usually reads all the studies and then has their own study on how they'll include the particular studies. So it tends to be very rigorous and has a lot of prestige with it, and is a great way to get quick information because it's an expert in the field that has read all the literature. So that's very advantageous when you're in private practice, a busy practitioner, and you might not have time to read, 300 articles on a subject matter. So I tend to like to gear the private practitioner towards these types of studies. So this is just showing you primary research. So that's someone does a clinical study, and the secondary researcher is someone who reads all these studies and then synthesizes the results and has a statistical analysis of the synthesized results and publishes that in a journal. So that's called secondary research. So clinical practice guidelines, they're secondary evidence, meaning that someone researching or talking about somebody else's research and incorporates the best available scientific evidence to support clinical practice. Evidence is analyzed by a panel of experts, and it's always changing and evolving, meaning it's not static. oops, sorry, I didn't mean to cut through there. So some examples of databases that we use to find this research and literature. One example is PubMed, which I tend to love because it's free and everybody has access to it. So we'll show you techniques here in the library of different databases that Middlesex has, but certainly if you're on your own in private practice, you still might not be able to use the library like you did when you were students. So we'll be showing you a couple of techniques that you can continue to do literature searches as you graduate. So there are some evidence-based dental journals which are very helpful because they're always reporting the highest levels. And then professional organizations can be very helpful, and often those are the resources for the clinical practice guidelines. So it could be the American Academy of Perio, the American Dental Association, the American Dental Hygiene Association. Those are examples of professional organizations that might publish the professional guidelines. So there's a process to evidence-based, and we'll be helping you with this process in the next 2 years, and you'll be doing research next semester and beginning the process. And then the next semester you'll be doing a project where you'll be looking up your own research and doing your own searches. So we'll perfect this technique as you're here in the dental hygiene program. So the skills that are needed to apply evidence-based decision making: you need to convert information into clinical questions that can be answered. And these type of questions, it's called Pico questions, which you'll get help developing. You need to conduct a computerized search, and you want to try and do that in an efficient manner. And at first it won't be efficient, but you want to learn how to get quicker at doing those searches. And you need to critically appraise the evidence to make sure that what you're reading is valid and it's useful. And we call that being clinically significant. You need to apply the results, appraise the evidence in clinical practice, see if it's working for you, and evaluate the process in your performance so that you're always getting better with this process. So, practical application. So there are online databases, and easy internet access makes it more helpful for us these days. And we're going to critically appraise the information, correctly apply the current evidence from relevant research to clinical decision making. And hopefully this will end up helping our patients in the long run. So here's what is called the Pico process or Pico question, and it kind of always has this format so that it begins with a patient, you have a problem, which is what the P stands for, and intervention is the I, the C is for comparison, and the outcome is the O. So the framework is very similar to this, and you insert your new problem or your new question depending on what you're looking for. So it might be for a patient with gingival recession, what is more effective, a chlorhexidine varnish or a chlorhexidine rinse on the effectiveness for preventing root caries? So that might be an example of a question you might look up. Excuse me. So then you're going to do a computerized search, which takes tons of practice, and I've done this a million times and I can always get better at this. So just kind of patience, and hopefully this semester we do an exposure and you just keep getting better with this. So you can search PubMed, other databases, and you always want to get peer-reviewed research. Peer-reviewed means the experts within a specialty area have reviewed the research, ensuring that the research is valid, original, and significant. And the goal is really to find the highest level of evidence on that pyramid so that the clinician begins with reviewing citations that are retrieved under systematic reviews. So some tips: you're always trying to streamline, make your search as simple as possible, relevant as possible. You'll be creating a Pico question, and you'll be doing a search in the databases. And a lot of the databases will have tutorials, so if it's new to you, you can always get help or do the tutorial. Then you need to appraise the evidence. What are the results? Does it apply to the patient? Does it apply to my particular question? So is it statistically significant? What is the likelihood that this study will replicate itself? What's the difference that will exist each time this experiment is repeated? What is the the statistical significance is reported as the probability related to chance or p-value. And here we kind of go in statistics a little bit. You can, you will soon, or some of you have already taken statistics, so you might be very comfortable with the p-values. But this p-value is a set point where the null hypothesis, and that means that there is no difference in treatment groups, will be rejected. So the p-value should be less than 0.05, which means the probability is less than 5 in 100 that the difference occurred by chance. So that's always, you see the p less than 0.005. And if you haven't had statistics in that just little last section, made your head spin, don't worry about that just yet. But it's basically it's a very rigorous way of looking at the literature and making sure that basically everything happened because of your treatment and not just by chance. And maybe that's its simplest form, which is fine for today. So clinical significance, and I love this, because sometimes you'll see a new periodontal study and it'll say, there's huge improvement, and you'll look at the tables and the bars are very different, and then you look at the access and it says it's actually an improvement by 0.2 millimeters. So 0.2 millimeters, what is that? Would you even notice that on a probe? Is that important? Would that be relevant to your patient? Is 0.2 millimeters important? So that's kind of what clinical significance means in a nutshell. And then it might be clinically significant, but it's going to cost $1 million. So is that really practical? And it may not be. And a lot of times new research is very expensive, and it might not be worth the money for that. So those are all thinking about clinical significance, and is it worth it, really? So then we apply the results in clinical practice, we discuss the findings with our patient, consider all factors, and then we evaluate the process in your performance. And like I said, we can always get better with research and interpreting the results. So the outcomes of the care provided and then the application of the skills is what we're looking for.